On this episode of TLC Connections, Julie Knudsen is joined by Daniel, Teklu, and Yette Asfaw, co-founders of Nunuye Charity, a nonprofit dedicated to expanding educational opportunity, improving health, and supporting children and families in Ethiopia. Inspired by the legacy of Daniel's late sister Nunu, the organization has grown from a single project supporting an orphanage into a mission that provides school supplies, computer access, nutrition programs, and opportunities for girls to remain in school. Together, Julie, Daniel, and Yette discuss how small acts of generosity can create lasting, sustainable change, one child, one family, and one community at a time. We hope you enjoy the episode.
All right. Hi, good afternoon. My name's Julie Knudsen. I'll be your host today at TLC Connections podcast. Really excited to welcome Daniel, Teklu, and Yette Asfaw, the founders of Nunuye Charity. I'm excited to jump into this. You know, our mission here at TLC, we talk about one choice, one moment, one connection at a time. And we connected today from our recruiter, Susan Kiernan, who lives here in Pennsylvania, and you came up from Maryland. So I'm curious how you got connected to Susan and what brought you to Philadelphia or the Pennsylvania area, I guess a couple months ago.
Sure. So Susan and I go way back. We have known each other for about 20, 25 years, 30 years. We used to work together in early 20s. And then our friendship continued after that. And then when we told her about the Nunuye Charity and the kinds of works that Nunuye Charity does, she was very much interested in hearing about Nunuye Charity and the work. And when we expressed to her the kinds of platforms that we're looking to spread the news of Nunuye Charity, and she connected us to you guys so that because I think the podcast at the time was starting up, and she thought that the mission of Nunuye Charity and the kinds of work that you do here really goes really well with it. So that's how she connected us.
All right. That's a perfect segue. So please tell us more about Nunuye Charity and you know, what drove you, inspired you to start the charity, and what you thought the connection was from TLC, what was in alignment.
Okay. Before I answer your question, thank you for having us, Julie. Thank you to the Lincoln Center for having us here. We really appreciate it. Also, you know, Susan, she's not only a friend of Yette's, but she's also a supporter of Nunuye Charity. So we really appreciate her support. She, you know, connected us after our last fundraiser. So that was really good. All right. So why do we think really Nunuye Charity, what Nunuye Charity does and mission actually goes with what Lincoln Center does? So the mission of Nunuye Charity is supporting the communities in need in the areas of education, health, and nutrition. Especially we focus on children's education. We can go more on what we have done so far, but the mission of Nunuye Charity, it seems like really goes, it's very close to what the Lincoln Center does.
So I know that you're both co-founders of the charity. When did you, establish the organization, and what drove you to do this?
Right. That's I can go back. So Nunuye Charity was founded in 2019. But to give you the background on how we started this, so in 2018, my sister passed away from cancer. Her name was Nunu. We called her Nunu at home, but her name was Teklu. So after she passed, as a family, we just were sitting and, you know, talking about her, thinking about her, what she did before she passed away. She's been very, very supportive of children. She's always been, you know, helping and supporting children back home in Ethiopia. So we thought that we continue her legacy by helping children and the people she's been helping. So we kind of like, as a family, raised some funds, and then we went to Ethiopia. And then we connected with an orphanage there that we were going to help. And then after we went to the orphanage, we were really touched by what this orphanage does, especially the person, his name is Fikre, who runs the organization. And we asked him what help he needs. And he asked us, I need a library for my kids, for the orphans, and library and a computer center.
Mm-hmm.
And we promised that, oh, okay, we'll deliver this to you. We came back, we raised more funds, and we established a computer center in that area, not only for the orphans, but for the kids in the community.
So was it informal at that time? I know now
Yeah,
you're a
it was
registered
informal,
501c3, so it was just
Yeah.
kind of friends, neighbors, family.
Yeah, that's it.
Yeah.
So friends, family, and all that. So we were just contributing friends and family. And then we came back. We did that project, and we were really impressed by ourselves, what we can do by small amount of, funds that we raised. And then we decided to go ahead and established it formally as a nonprofit organization. Now, Nunuye Charity is a 501c3 organization based in Maryland.
And when did you establish it?
That's in 2019.
Oh, so shortly after your
Shortly
first trip.
after, yeah.
And how did you connect with that orphanage? Were you aware of it? Is it in the town that you grew up or where Nunu grew up?
Yeah, I can start answering that again. So I grew up in that area.
Mm-hmm.
That area is in northern part of Ethiopia called Tigray. The city is called Mekelle. So when we went, so this area is really, of course, in Ethiopia, you have a lot of needs across the country. But because of so many reasons, famine, drought, and even man-made conflict issues, there's a lot of need, especially in the areas of education and nutrition and health. So when we went there looking, we really didn't know about the orphanage. So when we traveled there with my cousin, someone introduced us to the orphanage. Say, you guys need to visit, come and see how great this orphanage is. And the person who founded it, he literally goes around the streets and picks homeless children and raises them. Now he has 70 kids in the orphanage. So we were really impressed, and it just really touched us. Although I was, I grew up there, I was raised there. I was lucky enough, my parents could afford to send me to school and have enough food at home. But there were a lot of kids, even whom I grew up, they didn't get that chance. So I was really touched, and I said, okay, we need to do more to help not just this orphanage, but even do more than that. So that's how we connected with the organization. Is called Human Beings Association of Mekelle. We're still in contact. We can go more in detail about what we do with them.
So education is not free for children in Ethiopia? For people, in America, it's like every child's entitled to a fair and appropriate public education?
But even if education is free, there are so many obstacles that children and as a whole country that we face, from poverty, from results of conflicts, there are so many, the magnitude of the issues that become obstacles to schools are so many. For example, due to a certain conflict that was created around the area, there is destruction to the schools. There's destruction to the school infrastructure, etc. So
When you say conflict, you mean war or
war,
physical?
yes.
Right.
So
Mhm.
and then there's also a lot of poverty and the need for those family members maybe not being able to send their children to school, even if school is provided for free. So there are a lot of compounding issues that could prevent a child from attending schools. So even if the education is provided free, there are other issues that prevent them from learning.
And when you say this orphanage that you've connected with, it's literally picking up children off the streets. Is that because parents are lost,
Yeah.
killed in the war? And
Again, yeah, that's one reason. But also, going back, so this is, the common issue across so many developing countries, especially in Africa, right? Just to give you a figure, right? In the areas of education, so Ethiopia is a population of over 128 million people, right? In that, 30% of children under the age of 15, which amounts to close to 17 million kids, are out of school. There's no school infrastructure to provide to these kids. And then you also have the resources. Maybe the families cannot afford to send these kids to school. Maybe the kids have to work to support their families. So there are so many reasons on why kids are out of school. Just lack of resources, lack of infrastructure. Then the conflict is
Right.
another reason. So what Yette touched on, for example, recently, there was a civil war in that area. 3.5 million kids who were in school were out of school.
Mm-hmm. Because there was no more buildings. The buildings were
So
destroyed, or you said all the
buildings
various
will be
reasons.
destroyed. There's war, so the teachers are not there to teach them.
Right? Okay.
It's not safe for the kids to go to school. So war just affects a lot of things, right? So even 1,400 schools were destroyed in that area.
Mm-hmm.
So it's not just it's a compounding effect of lack of economic progress and lack of investment in infrastructure and education.
Did you experience that growing up as well, or it's been more recent conflict, or those challenges have always existed?
Yes, those challenges have always existed. Again, we were fortunate enough our parents could afford, but a lot of our friends, we don't even know where they are now, some of them. So that happened. There was a lot of poverty around us, but we were lucky enough to get that education and to get to where we are now. So you can see now the impact of education on child's life, right? So what we're trying to do is even provide one child that opportunity. That education in primary school and secondary school just changed the trajectory of that child's life.
I've been a lifelong educator myself and was fortunate enough to be in Uganda this summer. That's what I was asking, was so humbled. Education is not free. Again, in America, kids go to school paid with taxes, but I learned in Uganda, parent has to pay. Could be a small fee, so it isn't free. And then the access of walking, lack of food, those kind of things. So
the
it
distance
sounds like it's
also.
similar in Ethiopia, that you still have a small fee and then all the barriers to get there.
Well, in most
Right.
cases, actually, there are no fees, but
Yeah.
it's just the lack of even the parents not affording a pencil, a pen. Like you say, to send the child, sometimes they prefer for the child to work at home.
Yeah.
So even maybe there is no school in that area. That's also another issue, right?
So when you
So the
connected with this orphanage, and the computer lab was one of the first projects, how has it expanded now with educating more children?
Yeah. So I'll touch on, and so Yette can also add on that is, so we connected with this orphanage, and as I told you, we implemented this computer center. So we pay for the instructor, we pay for the internet service. We also pay the feeding program for the orphanage, by the way. So we pay for their food for this
I saw
orphanage.
it's about
We send-
70 or 80 children
yeah,
a month.
70
Yeah.
kids. So that computer center is really successful. So it's really not only giving, imagine like affording a computer in that area for a child is impossible. So getting these kids the access to the internet, that the fact that they can actually sit and connect to the world through the internet was just an incredible experience for them. So that has been really successful. So that's still going on. Then after that, we implemented a few other projects. One of the projects is after the war, actually prior to the war, we were helping kids by supplying school supplies, by providing them school supplies. By what we mean by that is pencils, pens, everything they need to go to school.
And can I ask, how are you doing that from the States? Were you shipping things? You have contacts on the ground there? Are you bringing them?
We have local partners.
Okay.
So we have very good local partners. Nunuye Charity we're only in Maryland, we're not in Ethiopia, but we do this by partnering with local partners. One of the local partners I told you about is the organization that runs the orphanage, is our very, very, very strong local partner. So we send the funds from here, but when we send the funds, we craft the projects from here. We identify a need, we discuss with them what the needs are, we craft the project, we plan the project, and then we finance the project and transfer the funds and making sure also we monitor the progress of the, we get, reports about the progress of the project. And then, from once in a while, we go there ourselves and look at how successful the project is.
So can you then expand, like you said, the orphanage, again, has been a great partner. The computer lab's been so successful, and you've touched on some of the feeding and the healthcare. What was next?
Yeah.
And how did you determine next steps?
Yeah, exactly. Then it's the need, right? So when we connected with the orphanage, when we built the computer center, obviously the orphanage raises funds to feed these kids, or he goes around the neighborhood to get food to feed the kids. So what we did is we get his budget every month to feed these kids, and then making sure that there is food on the table for these orphans, right? And then we discuss, okay, what can we do outside of the orphanage? So we identified this village school in a village called Angesti that has over 800 kids. I went there to visit the school. I was really devastated by the lack of infrastructure. There, they had no desk. The blackboards were broken. The kids are just sitting there with no pencil or anything to write on. They don't have books. So I was really amazed, how can we change this school? So one of the things actually that I observed there when I was there, the other thing that I observed is in the primary from first grade like to fifth grade, the boy to girl ratio is almost the same. And then you go fifth grade, you don't see the girls. It's almost like 80 to 20. I said, where are the girls?
Is that the menstruation?
Yes.
I read about that. I thought that was incredible to partner with an organization.
Yeah.
Please
so
speak to that.
I asked the principal, I said, where are the girls? What happened to the girls? Like, you really want to know why they don't come? Because they don't have the sanitary pads and they feel shy. Once they experience that, they don't want to come back to school. So we said, okay, we need to fix this right away. And then I came and told Yette about it, and you can discuss about that effort.
Right. So it's like Daniel was saying, the amount of girl to boy ratio in the primary schools, which is ages 7 to 14, is almost 50-50. And so 87% of the girls in that age group attend primary schools up to the age 14. Then once you get to age 15, that number dramatically decreases to 34%. That's a lot of decrease. That's a lot of girls who are missing out school for reasons that could be, prevented, or for reasons that could be helped so that they can continue education. And very crucial for children or kids to stay in school so that they can change and empower themselves to go to school, have a future, have hope, and have some sort of future to build on, to stay in school.
Which is very universal.
Which is very, yes.
Right, which we promote here as well, right?
Right.
With alternative education.
Exactly. Yeah. So staying in school is very important, and changing the life of one girl. It doesn't only stay for that one girl. It has a lot of radiating effect for that girl. It's her family, it's her children, and she also serves as an example for what the future could look like if a girl goes to school. So what we did in that aspect was we purchased sanitary pads, reusable sanitary pads that the girls can use so that they'll be able to go to school. And with that sanitary pad, it costs very, very, very little in comparison, because that reusable pad it could be used up to 6 months. So if you provide, say, a girl with 2 pads, that would last her a whole year. That means she finished 8th grade, she would finish 9th grade, so on and so forth. And the cost of that pad is $10 for 2 pads.
Yeah.
Yeah, and
such a small thing that is
right and
tremendous.
Right, and sometimes unless it's put in such a way that is in practical terms difficult for your average person to imagine how much $1 or $2 can make such a significant difference in a person's life. It's not only the person that is setting up for success. It's also the people around them, the families, the children that could potentially see the future.
So have you had enough time to look at the data with that after you introduced the
Oh, yeah.
pads and how many girls?
Yes.
They stayed.
So is
They
it back
stayed.
to
They came
almost
back to
50-50?
school.
They
Yeah.
came back to
Wow.
school.
Congratulations.
Thank you.
Yeah.
Thank you.
Thank you.
Yeah.
Thank you.
So as a continuation to that, again, is we can also, what we did to the school once we provided that, unfortunately, civil war started and the school closed and it was destroyed again. So we had to, after, the guns was silenced and peace came back, we went back to school and the kids could not come back to school because the desks were destroyed, blackboards were destroyed. Even before the war, it didn't have enough. So we crafted a project again. We furnished the entire school. We renovated the entire school first, painted it, cleaned it, everything like that. We purchased all the desks for 800 kids. We purchased school supplies for all 800 kids. All 800 kids came back to school. Now the school is operational.
That's incredible. I wonder the trauma piece. It's a lot of what we do at the Lincoln Center. I'm a clinician as well. We do like trauma-informed de-escalation. We work in schools here with the kids in the village that you are supporting with the war. And is culturally or my ignorance, is that something that's offered, or mental health and that hypervigilance?
The amount of issues that we have in such a underprivileged country, underprivileged population, so much so that you can only start with providing them with the basics and the practicals. That indirectly serves, or directly, depending on which way you look at it, provides a way, a therapeutic, if you put it that way, therapeutic way of continuing after what they have gone through. So we try to tackle the ones that we can have the most effect, which is by providing them something so that they can continue where they left off. Things that are on the clinical level and on the mental illness, mental issue, or mental well-being is something that we haven't tackled yet, because we try to focus on things that are of immediate need,
Right,
that are
food.
desperate need,
Yes.
and things
Shelter.
like that. Food, shelter, health, things like that.
And having a place to go, which is part of like the mental health well-being, is safety, right? So they have a place now to learn that's safe, that looks nice, that has a desk and a pencil.
Yeah. And, in a way, going back to where you stopped before a certain traumatic event happens in your life is the first step in going towards healing. So, given our infrastructure and what we stand for, we try to supply and try to do as much as we can so that they can at least have the basics to continue the healing process itself.
So this is then the school is another project, the orphanage and the computer lab, and these 70 children, are they part of the 800?
No, they're separate.
They're separate.
They're separate. So we started at the orphanage. We still are engaged with the orphanage. We're still supporting the orphanage. We're still supporting the computer center. But now we're venturing out because now we see that we can actually make more impact, right? So that's the reason they're not the same. Actually, they are two different towns.
How far apart?
I would say like 100 kilometers or so.
Okay.
So that's how far apart they are. Then, if I may, also, is we touched on the girls, is the other projects that we've been doing is also women health related. You have a lot of women. Again, it goes back to education, right? You have a lot of women who didn't get this education, who don't have the basic, nutrition support for their kids. They are single women with kids because of the war, or they're one of the projects we did was HIV positive women. We worked with the local government to identify HIV positive women and supply them with nutrition support, because for them to stay healthy, they need to eat well, right? So if they don't have the resources to really eat well, then it becomes so. 120 women we identified HIV positive women, and we supported all these women with funds to purchase, food for themselves and for their
So
families.
what did that segue look like? I followed you now from the orphanage to computers, the success, education, because we can, support more children. How did that take you, I can understand, but explicitly, how did you lead to then supporting these women? Were they mothers of the children in the school?
No, they're not. Again, so what we do is with these partners that we have as local partners, we ask them, what are the needs out there? There are a lot of needs, right? So education is something we're passionate about and we would like to continue working on. What are other areas that we can support? Because supplying nutrition to people in need is also Nunuye Charity's mission. So our local partner identified this need. Say we have a lot of single women who don't have support, who are waiting for food aid. And some of them are really HIV positive and they are really in need. I said, okay, why don't we start with the women who are, HIV positive and see what we can help. So the local government and our local partners identified these women, and then, we send the funds, and then the funds were distributed to them. So what we do, what makes us unique as Nunuye Charity, since we are a very small organization, right? I'm the president of Nunuye Charity. Yette, my wife, is the secretary general. My cousin is the treasurer. We have board of directors, so we don't have really a big staff. So the resources and funds we have are limited. So what we do is we identify the project first. We make sure that every dollar that we get, we raise goes there. We have zero overhead.
Yeah.
So we really work closely with our local partners in identifying a project where we can make the most impact. So children's education, children's nutrition, women's health. I will also go on to another project that we do with elderly people who are in need as well. So these are projects that we identify and then implement that are part of our mission as well.
The growth is tremendous because to maintain the sustainability of the need and with a small organization, you guys are digging deep.
We are. And as we identify more need, the more you do these kinds of things, the more calling you have there's because the amount of issues that could be helped are tremendous. So what we realize as we complete projects, and the way we do projects is from end to end. It's very short term, goal oriented. We start it, we finish it, and then we move on to the next project. So,
But the women will continue to need support or health
Right.
care. They don't seem unending. Children.
It is.
right.
So
It's so.
Yeah.
So
I guess
say
you get
for
them in
example,
place,
it
so
could
they're-
be at least
Yeah.
we get them over the edge, and until the next problem comes.
Okay.
That kind
Because
of
you're not
thing.
walking away. No project is
No,
done.
No, we don't, and we don't want to walk
Yeah.
away. That's
That's
the
the thing.
take-home message: is we don't want to walk away. We want to create a situation where it's sustainable. It's so that the ones that are being helped can find a way to be self-sufficient, so that they can help themselves, and help their families. So we want to move out of this vicious cycle of where you provide the support, it's short-lived, and then what's going to happen in the next 3 months, 4
Like the
months.
saying, give a fish or teach somebody to fish.
Exactly.
Yeah.
Right. So that's the kind of move or plan we have going forward, is to make whatever we do, the projects we do, sustainable for those that are being helped, so that themselves can help, stand on their feet and have a sustainable income, so that they're not dependent on an.
Yeah. To if I may add that, Julie, is the project that we're just crafting. Actually, we're going to sign an MOU. Is we're getting into training the women and give them seed capital to start small business. So these women, instead of waiting for our food aid or for handouts, they can start a small business. Maybe they can, sell eggs or do some small business handicrafts or something like that. So that project is almost going to start soon. It's a pilot project. So if that is successful, we would like to scale it up. But the need is massive, right? The data that we gave you earlier is actually reports from the UN that they did in 2023, the UNICEF. I can give you one number, for example, is 37 million people in Ethiopia in need of food aid. 37, half of them are children. So we won't expect Nunuye Charity will solve these problems, but at least if we can change the life of one child, life of one woman, it's worth it.
Sure. And ultimately, if they can change one,
exactly.
I understand.
Yeah.
So it's an effect, right? You educate one child, he can change or she can change a lot of things across, not only on their lives, but their lives in within their families as well. So
what would Nunu say now?
oh, don't make me cry.
It's okay, you can cry.
But yeah, I mean, we're really proud of what we do, and this is something that she started. She thought she was doing something small. She was just doing it by herself, not even. But the fact that she inspired us to do this, again, to your connections, right? That's what you say, is massive, right?
So really, what would she say if she came to this table and read your website?
I think she'll be very proud of us. I think that we have continued this. We've been able to impact way more kids than we expected in such a short time. But we want to grow. We want to scale this up because there's so much need.
And when you say that, what do you mean? Like, what does that look like? Have that kind of vision scale to what capacity?
As much as we can. I mean, it's right now, as Daniel was saying, it's just run by a very small number of us. It's like a family business, not business, but a family model where we are doing this not as our full-time job. We have full-time jobs. We're doing this in the time spare time that we have. And as much as we have, we have done this far, we have gotten this far, we have seen the effect that it has. So we would like to expand it as much as we can. And of course, when you go from doing something small to expansion, so the number of things that you're going to need are also that exponential, like funding, the platform to be able to expand these things, for example. I mean, right now, what we're doing in terms of collecting funds is we host a fundraiser in our own house from friends and family and things like that. And people have been very, very generous. But those
so it's
kinds
like immediate
of
connections again. People that know you directly,
Yes.
or
Right.
like one
That's it.
removed. Yeah.
Mm-hmm. And or then they tell their friends of the work that Nunuye Charity does. But that kind of connection can only go so far. We need to expand it in such a way that we can reach as many as we can. Because, like Daniel said, given the massiveness of the issues that need to be addressed, a larger platform, a larger form of funding, and a larger staff and manpower is really needed.
And I guess you wonder about like mission drift because of that need being so overwhelming, but to stay in the aspect of education,
Yes.
healthcare.
Mm-hmm.
Yeah, we would like to stay, especially in education, educating children, because, like we said, the impact it has is long term, right? But
Right,
we
because
also
you're talking women's business. You have a piece here, and that
Yeah.
can sometimes
that
get
can
fragmented.
that is true. You're right. That's a
Right.
very good point. But our core mission is, educating children, making sure that all boys and girls stay in school, and get the necessary resources that they need to educate themselves. From having a good school to go to, the desk to sit on, computer to educate from, a book to read from. These are the things that we will continue to do. But again, women's health, how women, especially Julie, you've been to Africa. I saw your great work on the website, is women are the core of every family in Africa. So supporting a strong woman means supporting the entire family.
I
So
was also surprised in Uganda in terms of school behavior. There would
mhm,
be 80 or 90 kids in a classroom, and they were just seemed very so grateful to be there.
yeah,
Here in the States, it's a little bit different with discipline problems or some mental health issues. That,
yes.
Right.
do you find that 800 children that you're supporting?
These kids are really very resilient with
Mhm.
all what's happening, how climate change is changing, you know, food production. That's one of the reasons, right? Drought, famine, climate change, war. It's not their fault. All these problems are happening. They're very
AIDS.
resilient, right?
Mhm.
Um, all they need is that support so they can be successful. They're very hardworking. The people are very hardworking, and the kids are. It's amazing to
Given
see them given the resources. It's
Yeah.
incredible.
And
So
you also have to remember that we are a product of education. The reason we are here sitting with you talking about this is because we have had good education. So our core mission will continue to be educating the kids to make sure that they have the opportunities. Like, we're the byproduct of having opportunities to be educated.
So clearly, war is just a horrible challenge, but
Right.
other challenges, or what have been some of the biggest challenges that you've come up against with Nunuye Charity?
So the main challenge is lack of infrastructure, right? Lack of investment in infrastructure. What do you mean by infrastructure? Like roads, schools, clinics. You need to build this first before you can actually provide these services, right? So the schools are run down, even the schools that exist there. Population is exploding, but there are no enough schools, there are not enough clinics. So the main challenge is the infrastructure, right? Um, so that is really the challenge that we have, that we see that's causing this ripple effect. So we'll continue to do our part. Obviously, the local governments have a lot to do to support what's going on there, but we can also help some of the filling in some of the gaps, right?
Can't imagine. How is it for you? I think you have been back to see, I know it's hard, you don't get back often, but to see what you've done. I know it takes a community, it's not you two in isolation,
Yeah,
but as a consequence of a tragedy of losing Nunu, to then see how many lives you touched. I can't imagine what it's like going
it
back.
is. It's very humbling. Again, we are from there, right? We could have been one of these children with no education or stay somewhere. We just were fortunate enough that our parents were able to support us, help us get there. So you know, so it humbles you, because I am that child. I was born here. So how did I end up where I am now? So the fact that I can do something, give back to where I came from, or help another child to get the opportunity to educate is humbling. We don't go that often, but we get, with these days, the internet, the videos, they send us all kind of
And
videos.
progress, do you know how
Yes,
the children are doing academically? You get those
yes, we
reports?
get these
Yeah.
reports.
And with every project, what Nunuye Charity does is there is always with any project that's implemented, there's the initiation, and then there's a certain time period of follow up. And then we do our due diligence of monitoring to make sure that whatever we started is effective. Like, we have to be able to measure effectiveness, completion, and things like that.
And it's interesting. I know you actually have your two sons with you. They're waiting outside, two teenage boys that were born here.
Yes.
Yeah.
How has this experience been as a family and their involvement?
For kids, I think as a parent, I can see how being in a post-birth country like the U.S. can not make you as much aware as because you take everything because it's available. It's a very resourceful place, and everything can be gotten basically. So this experience of them for them has been eye opening. Knowing that there is a child that's your age that's not getting 1% of what you're getting here, and that had they been born there, if I stayed there, if I didn't get the education that I didn't, then it could have been that boy would have been one of those children too. So we try to instill in them that they are very fortunate. That they are, whenever you have something, it's always good to share, to give back to the extent possible. Um,
The work
Yeah.
is amazing. Yeah.
I can give you actually one story. Alula, who is 15, you met him earlier. So when we started this back in, how old was he in 2019?
he would have
When we told
been
him
9.
they don't have, he made a box. He took it to his school, and he put pencils for Ethiopian children, and collected pencils. And I took those pencils and took it with me and gave it to them, and showed him, and it was really, that was really touching. So it's part of their, that now he wants to get involved with our kids on, and also other nieces and nephews. We're forming a youth group. So they're helping us. We are not very savvy with the social media communication stuff. So they're telling us, oh, you're not on Instagram, you're not on this. So they will help us maybe Nunuye Charity to get into that. So
Yeah, I think that's great exposure. I've been fortunate enough. I started as a 5th grade teacher in South Central Los Angeles, urban education, but I have been fortunate enough to travel in East Africa and to see what the kids go through, like literally not a pencil. Like you say that. It's no shoes trying to walk to school. Different.
yeah.
So many things you've highlighted that you're proud of. Anything
Yes.
you've missed I can recap. It sounds like the computer lab, the school, the sanitary pads. What if
Right.
some other successes? You're both smiling. Yeah, as you should. What amazing work.
Yes.
Yeah, thank you so much. I mean, I think I kind of touched on also with the nutrition, right? The nutrition help that we support. We also have, again, you went to Africa. There is no safety net for people who don't have, like we have here, social security, whatever that we support. They don't have. So when someone elderly person, they don't have a family support, basically they end up waiting for food aid. We also did a project on that, like identify the elderly men and women who don't have any support in that area. This is near the orphanage. And our local partner identified these elderly people. And we also, sent out food nutrition help for the elderly people in that area as well. So we try to do as much as we can.
Sounds like it.
Mhm.
So what is there a project out there, or does that kind of present itself, and kind of what's next?
The main one that we have is the training
For the women.
For the women. So that's almost going to kickstart very soon. So again, this is in partnership with our local partner there and the local government. So the local government will organize the training on basic, small business training. And then once these women are trained, we're going to send the seed money for them to start their small businesses. So that's the next project. The other thing is going back to the school that we just renovated and opened, and see what we can do there. Can we start a library, a computer center there? So we'll see.
So enhancing the school that you're already at, not to bounce around or more.
Yeah. So we want to make sure that we complete that school and use it as a template.
The demonstration.
To do other projects, similar projects going forward.
Just for a minute, so both have day jobs. And you briefly said they're not really related. It's not like you worked in nonprofit before. So Yette, what's just briefly your background? I know you said education was so important. What did you study?
So I studied in college chemistry. And then I worked in pharmaceutical industry, and then now I work in clinical research. Policies, regulations, etc. So it has nothing to do with nonprofit.
Yeah,
it has nothing to do with education.
Yeah.
But it's one of those things where it's really humbling to be able to be in this position to give back. When you see people who are in need, it's like, why am I here and not there with them? And it gives you that connection of saying, okay, if I can help one person, then the ripple effect for that helping that one person is just so big that you just can't stop.
Yeah.
There was a great Swahili word I loved, Ubuntu. I am because we are.
Yes, yes. Well, I also have a day job, a very busy day job. I'm in information technology. I'm a technical director for an IT organization. We support the government in IT. So it's a busy work, but any free time that we have, this is what we do. But it's not just us. We have cousins, we have friends who are really involved in this. We can't do this by our own. So we have really core supporters like Susan,
Yeah, I was saying.
your colleague Susan, and other close friends who do support this organization. So without them, we wouldn't do this.
And clearly the impact, right? The lives that you're touching, and like to ask the question, here we say one moment, one choice, one connection at a time. Can you think of a person, a time, an event that really changed your lives?
You want to start? I can start. I mean, I think for me was, we went this idea to continue what my sister did. The moment I went to that orphanage and met that man who runs the orphanage, made like a turn, I can say, impact for me to do this work that we're doing, because I was really amazed. He has nothing. All he does is just, I asked him, how do you get all these resources to feed 60 kids? It's like, God gives me. I was really surprised. Like,
That
no,
faith.
I will feed them. God will provide them. And he would go out and sees a child on the street, pick him up, wash him up, give him a bed to sleep in, give the child or a girl or boy food to eat. So when I spoke to him, and it was very, very impactful, I said, if he can do that with this resource, we should help him to do more. That's when I said, what can we help you? What can we do for you? So that moment was really a turning point. I think that, yes, we had an idea to help, but after we met him is when we said, we need to do this more and formalize it, create a nonprofit and do that. So that was, for me, that was really a turning point. Yeah.
Yette?
Yeah, I think for me it was, so when he went to visit the school that we renovated, I didn't go there. So when he went and came back, he was telling me, I'm like, oh yeah, there are kids and from age so and so and so and so. But like in the secondary school, there was 80% boys. It didn't dawn on me. I'm like, what do you mean? Where were the girls? And he said, no, well, I asked, he said, and the reason that they don't come to school is because of their menstrual cycle, and they don't have the means to be able to come to school when they're on their periods. I was really in shock. I mean, I knew there was issues associated with women and their menstrual cycles in general, but that kind of dramatic effect to the point where you see
Literally
them,
see
you
the
see them here,
yeah.
and then you don't see them
Right.
there was really, that really hit home. So a lot of the projects that we do when it comes to women and girls, I'm usually like I'm ready to go.
Yeah. And did you find that organization? I tried to, glance at it a little for the reusable sanitary pads. I wasn't familiar, so you did some research?
No,
and-
she is actually, the person was a recipient of the
CNN Hero
the
of the
CNN
Year.
Hero
Who developed this
Award.
company?
Yeah.
Yes,
This is-
yeah. I believe it was Fikri who
Told us about
told
it.
us about it, right?
Yeah. Because the factory that she founded was also in that
In
region.
that region. So there,
So we-
the community is familiar with that factory and what it does, and that its availability, just that there are no funds to buy it, or the means and ways of going there to buy it, even if you have the money, and thinking to provide it to the kids, the girls in school, so they don't miss school. So it's
So you took the lead and kind of brokered that from here, made that connection,
Oh, yeah,
raised
we
the
made that
money.
connection. So
had
our
somebody
local-
go and get it.
Yes, our local partners went and visited it, and then we sent the funds to, obviously, a number of girls we had in school. So we did. So we're still doing that. There are also other suppliers now doing the same thing. So recently, when we opened the school again, we made sure that not only the girls got the pencils and their journals, but they got
they
the
got the
sanitary
necessary
pads.
supplies.
Yeah.
It's just as important as the pencil because you got to
sure.
go to school.
Yeah. So how do you plan on scaling up now, given the great work that you've done and seeing the enormous need?
Yeah, thank you. That's actually a very, very important question for us. So as we touched on earlier, Nunuye Charity is just a small family-run organization, nonprofit, right? So we don't have a big staff, or to raise funds or to write grants, or so. We're looking for that kind of support in terms of supporting us, where we can raise not just from family and friends, but from organizations who have the same mission, who can support us in giving this support. So that's one area that we're looking for. Yette touched on about the fundraisers that we do at home. That's good. Again, few friends and who come to the fundraiser and give us money. But if we're going to need to scale this up, we're going to need more resources, which means asking for grants, maybe reaching out to bigger organizations who can partner with us on this mission. These are the areas that we would like to work on scaling up.
Yeah, and hopefully as our TLC Connection podcast, we get a bigger audience, would also be a
Right.
platform.
Yeah.
The people that are listening that could go to your website, which is nunuye.org, and can learn more about what you're doing. Yeah, the need is tremendous. I've, again, working in development now. I've worked in the past between locally, state, federal, nationally, internationally. It's a lot of people need support. Yeah, and I think, like you've said, you're there starting with the computer lab to see, and then there's this, and then there's this, and it's just kind of really is endless.
Yeah.
However, your model of the sustainability is beautiful. Teaching the kids to get an education, they can.
Yeah, the challenges are huge, right? So, but you can't just, not do anything because the challenge is huge. You can change, society one child at a time, one woman at a time. So you just have to do what you need to do, what you can do, and then make that ripple effect.
Right. And making people aware. I think sometimes we don't know what other communities, what children, even
Right.
knowing my ignorance, current civil unrest in Ethiopia, right? It's a different part of the world.
Mm-hmm.
And the kinds of changes that we want to bring about is not just addressing the problem as it stands right now, because the problems will continue to exist unless we find a way so that we can make it sustainable for the individuals to be able self-sufficient. So in every project we do, the end goal is for the recipients of those aids or help or any kind of intervention that we're doing to be able to self-sustain so that they can stand on their 2 feet or help their family or have a future even for their family. So we always try to keep that in mind, because if you just, feed a family for 3 months, what about the next 3 months? That kind of thing. It's very cyclical. So we're trying also to get away from that cyclical and aid food. Instead of that, is find a way so that those people can find the source themselves.
Right, like this final
That's fine.
project,
That's
not
like
final,
the
but the next
woman's
project with
right.
the women, right, to make some income, to get the
Yes.
necessary
Right.
things for their children. The education then is there, so
Right.
that cycle, that beautiful circle.
That circle then really changes into something that is long-term and permanent instead of just short-lived patches that we try to get away from them. But sometimes the need can be so dire that sometimes you just have to do that for now and then plan for more sustainable efforts in the future.
So again, I just want to thank you so much for taking the time, for making the drive from Maryland to come out here and meet with us and to record this podcast. It's truly been a pleasure and an honor, and the work that you're doing is remarkable. I know it's remarkable. I've always worked with children, and you change the lives of one child, how you really can change the world, and you're living it. And I haven't met your sister-in-law. I can't imagine how she would be feeling knowing what you are doing. So thank you again so much.
Well,
No, thank you for having us. We really appreciate it.
thank you so much for having
Thank
us.
you. Thank you.
TLC Connections is supported in part by the Lincoln Center for Family and Youth. Through education, counseling, coaching, and consulting, we empower people to make positive choices, meaningful connections, and transformational change. To learn more, visit thelincolncenter.com.